Or do you see most of the patients that are?
No, I do not see them as a nurse practitioner. That's very important to clarify. That realm of caring cannot be somebody's medical provider. So what we're going to do is that we're going to start providing education to providers who want to follow these patients. Right now I do, talk to patients, but we're a small group of friends, really. I'm talking to my fellow friends. But when we grow to 3,000 plus patients, I won't be able to do that. And we can't do that legally because we're not going to be healthcare providers. But we will talk to your neurologist, we'll talk to your primary care doctor, we'll talk to your acupuncturist, your chiropractor, your herbalist, your nutritionist. All of these people can recommend and follow because this is a dietary supplement. It is considered hemp, and so any provider who's willing to learn, that will be my job within the realm of caring, is educating providers on how to manage people that want to use Charlotte's Web for medical purposes. Process is the red card. If you're under 18, you have to have 2 doctor signatures. We have a doctor here in Colorado Springs that has 2 doctors in the same office, so you can get those recommendations, Dr. Getty and Dr. Anderson. And then they would follow you, give dosing recommendations for those things. So we actually have 3 products. We have the Charlotte's Web, which is going national. Then we have regular just THC oil. And then we have a THCA oil. So this started in Austria, where people were getting anticonvulsant results from using THCA, which is the inactive form of THC. So it has not been heated. It has no psychoactive effect. It's kind of like juicing. Right. There's a doctor in California that recommends juicing cannabis, so it's kind of that same concept. If you're in need of high quality, organically grown, tested twice, medical grade medicine, then we're calling it therapeutic hemp. Then get on the website and get on the waiting list in your state.
Great. Well, that's good information. I'll send that back to the guys in New York, and we should be flooded.
Yeah.
You talked to somebody at the FDA about what they needed to know, and the response was?
I think they had a misconception of how difficult it is to obtain the GW Pharma product. They believe that they weren't really supporting the other products because they felt like everyone had access to the GW Pharma, but it's actually very difficult to get. Charlotte's Web, which is the high CBD, low THC product, as hemp under the Farm Bill. And this allows us, if we are doing research, to distribute it as hemp. And so we will be starting a research registry and allowing people to receive it shipped to them. And that is just the high CBD product, Charlotte's Web.
Right. And that could go forward even if the bill doesn't pass in Congress.
Right, because it's under research. People that receive this in other states will be required to register within the research registry, answer questions. It will all be confidential, but they will be required to participate in research in order to be able to receive the hemp.
And what kind of time frame are they looking at?
This harvest, they will begin to harvest sometime October, November. Then, of course, they have to make the extract and those kinds of things. So we're saying November for the first couple starting patients, but those people have probably been on the waiting list a while. So I would say someone new just looking into it, get on the waiting list in your state. So you would go to www.therock.us, and on the top it'll say wait list, and then you pick your state and you add yourself to the wait list. And it'll just ask some brief questions. So if it's a child, the name of the child, the age and the weight of the child, and the diagnosis. And then we will systematically start working through those wait lists. So to say exactly how long it would take someone, But this harvest, we will be able to start 3,000 new patients or clients. They're not really patients. We're not providing medical care. That's important to say. So we will be able to start 3,000 more people on Charlotte's Web.
Wow, that's fantastic though. What an
Yeah.
effort that must have been to get that up.
Yeah.
And from like, it was 40 patients a few years ago?
2 years ago, yeah, I think it started with 40, and now we have close to 400 between the pediatric and adult. It's important to note that it's not just for epilepsy, neurodegenerative conditions, and there's research out there that it could actually slow down or maybe even stop the progression of neurodegenerative diseases. And so these are all things that, I mean, we're just scratching the surface of this research. You know, that was just one study, and of course you can't say something's fact with just one study.
Right.
But so the realm of caring, one of their main things is to do research, provide research. One of the reasons we're so busy right now is we have a deadline for Thursday for 3 letters of intent that have to go to the state of Colorado. So one of the things that Colorado did is they said that the money that they made from people applying for what they call red cards here in Colorado, which is your medical marijuana license, that they would use that for marijuana research. Or cannabis, whole plant research. And so we will be applying for 3 grants within that. And so our letters of intent are due Thursday, so we're kind of actively looking for that. So this is my son, Reggie.
Hi, Reggie. That's
a little cough.
Is it already?
Yes, it's okay, but probably needs a suction.
Right.
But Reggie was born completely normal. Somewhere around age 4 or 5, he stopped developing cognitively. At age 7, he started with seizures. Age 9, ataxia, which is the difficulty walking. And then, so this last 3 years has been pretty bad as far as he is wheelchair bound and those kinds of things. He caught a virus, and so he's dealing with that right now. So that's not typical. So he started Charlotte's Web November 22nd, and he had a solid 50% reduction in seizures.
Oh, wow.
And he's maintained that 50% reduction. We were hoping for more, but he's maintained that 50% reduction.
Wow.
Yeah. Sorry, I know the noises.
Is he how you got interested in this? Or?
Well, absolutely. We moved here to save his life. My daughter also has the same disorder. You met her.
Yeah.
She walks, talks. She's much more high functioning, but she does have seizures. And they were beginning to get out of control. We've been able to, and she was having all kinds of side effects of her medication. So hypothyroidism, she had gained 35 pounds. So we were able to decrease her medication by 70% and not have the seizures. So.